We're here with Michael Kane from Promotion Physical Therapy and Fitness, and today we're going to talk about function. He's our local expert for physical therapy and fitness. Michael, what is function?
Well, function, if you look it up in the dictionary, it says the normal and specific contribution of a body part to the efficient and effective performance of the whole organism. So what does that mean? Well, that means that the body's connected. And so if I took you as a physical therapy patient, let's say you came in with a knee injury, a functional approach would be to say, I can't just look at your knee as if it's just this hinge joint there and I'm just going to focus on it. I've got to look at the body in terms of saying, well, the knee is a connector between the hip and pelvis and the foot. So sometimes when I evaluate the knee, I need to look at the hip and the foot as well, because the foot could be affecting the knee. The hip could be affecting the knee. In other words, your knee pain might not be due to your knee at all. It may be due to loss of normal mobility and stability above it or below it. So that's an example of function as it relates to rehabilitation. Function as it relates to rehab, I would look at it, or excuse me, in relation to training, I would look at it like this. What is it that you want to do in your training program? Most training programs and most tips that you see are based on techniques. You pick up a magazine, oh, there's 1,000 ways to work your glutes. Look at all these new ways to work my abs. In a functional approach, we'd say, well, what is your goal? What are you trying to accomplish? If you want to have better abs, why? You know, if you're a bodybuilder, the why might be because I want to make it look like a six-pack, so when I'm standing on the stage, it looks better. You know, if I'm a volleyball player, it may be because I need good core strength as I jump at the net and try to spike that ball. That abdominal core needs to be able to load effectively to help me unload and hit that ball as hard as possible. So a functional approach would also be asking the client, what is it that you're trying to accomplish? If you say you want to be stronger, specifically, why do you want to be stronger? Is it for a specific task? Is it because you want to look better? Is it for a specific sport? Is it for your work? And that would be the difference, I think, in our approach. I'd call it a top-down approach, where you would tell me what your goals are, and then I would fit the program to you, rather than you coming in and I just say, oh, I got it. Here, you want to lose weight? Here's the program for you.
Promotion Physical Therapy and Fitness. Michael Kane, our local expert.